Hey, what's up, Dr. Emery and TA, whose name was not mentioned in the syllabus. My name is Michael Rosa, and I volunteered through International Volunteer Headquarters in Costa Rica this summer in a child daycare center. So I'm going to be talking a little bit about that and my time there. So like I said, I went through IVHQ, but the program was facilitated through a sister program called Maximo Nivel, which kind of oversaw all of the volunteer programs in Costa Rica, and then also connected students to community members who wanted to learn English, and so students could go and teach English if they wanted to, had free time, whatever the case may be. But like I said, I volunteered in a daycare center called Bebitos. It's a government subsidized daycare center that I'm going to be talking a lot about in the later slides. I stayed in San Jose in a suburb called Cedros. This was my host mom, Marielos, right there. Marielos Garbanzo, and that's her house that she provided for us. Unfortunately, I did not have another picture of Marielos, which is a huge bummer for me because she was the sweetest little lady, but I just, in the rush of everything, just forgot to take a picture with her. But she was very sweet. So what I learned in Costa Rica is a lot of differences from the U.S. A lot of differences. So first off, their healthcare system is broken down into a public and a private sector. So the public sector comes straight from their taxes. So based on your income, you pay a certain percentage of your income that goes into just healthcare. And so it ranges from, I think, 7 to 20%. And so really interesting fact, and it allows everyone to get free healthcare. Even tourists can get emergency services for free through this system. So it's really cool. Not something that we have in the U.S., but that was the biggest difference. Their private healthcare sector is mostly for the wealthier population, is the people who really can't afford it and do utilize it, just because the public sector gets overcrowded and it can be hard to get an appointment if you really need one, or a certain surgery to get higher on a list. You can do that through the private sector if you're willing to spend the money. So a lot different than the U.S., and that was one of the cool differences that I saw in my experience in Costa Rica. Free education was also a huge difference than Costa Rica. They have free higher education, so college was free for the students there, still is. We were right next to the University of Costa Rica in Cedros, where we were staying, so got to meet a lot of the college students that go there, and everyone bragged about the free healthcare system, or the free education that they were receiving. It was a really good program. They were all really stoked about it. So again, something that's a lot different in the United States, which both of these differences I believe that the United States will eventually adopt into our country: public health care and free higher education, or at least reduced costs and higher coverage of individuals. But that's something for the politicians to discuss and decide, and hopefully it comes to fruition soon. But another cool thing about Costa Rica is, according to the World Health Organization, it's one of the top countries for life expectancy. And what I saw there, and what the World Health Organization also feels are the reasons for this, is food, first and foremost, is always prepared fresh. They don't believe in preservatives. Marielos, my Costa Rican mom, would always talk about how bad cans were for you, and would always get really upset with me when I told her, oh yeah, I cook at home, but then explaining how I cooked and how I would take beans out of a can, or how I would use prepackaged rice, really upset her. She said I needed to prepare all my food fresh, because that's what all her family, all her friends, all her neighbors, that's what they do. So a lot healthier alternative, a little more time consuming, but that also plays into the pace of life in Costa Rica, and what I believe to be a lot of the Latin American countries. They live slower. Life is much more about getting to know the people around you. Dinners were always, together. We all sat together. We talked. It was a social event. It would go on for, at the short end, an hour easily every night, just talking to Marielos, listening to what she had to say about politics, religion, our day. It's a very, very social event, and it brings people together, but their pace of life is just, they walk everywhere. It's just different. It's a lot different than the U.S., and it was really cool to experience because it helps, obviously it helps people be healthier. So hopefully we can bring that to the U.S. and kind of be able to slow down our pace of life. We have it a little slower here in San Diego than the other big cities that I know of, but everything's really rushed. Everyone's just trying to get from point A to point B as quickly as possible. So maybe if we adopt that, the stress of life could go down a lot, and maybe we could live longer, happier lives. The cost of living was one of the things that I was surprised about in Costa Rica because food and clothing really weren't that much less expensive. I expected it to be way less expensive than it was here in the U.S., but that wasn't the case. If you went out to eat, given the exchange rate, you would pay typically what you would pay here in the U.S. for a meal. So you go out, you spend $15, $20 to sit down and eat somewhere. The shops for clothes, because I found some surf shops when we were around the coastline, and thought I would get a deal, but again, it was kind of the same price. Fun fact about Costa Rica, if you ever plan on visiting there or other Latin American countries, the one thing that I just couldn't get used to is they put their toilet paper in the trash can. So after you're done using it, you would put it in the trash can, not in the actual toilet, because they don't have the paper, and the sewage system isn't cooperative, so it ends up clogging up the system, makes a huge mess. So if you ever plan on traveling over there, that's something that you should keep your eye out for. So talking about the global perspective and its importance and its influence. So the importance of a global perspective in healthcare is we need to understand how other countries do certain things, because it gives us a way to evaluate how we do what we do, examine the differences, and examine the benefits and the cons of other potential systems. So for the universal healthcare, for example, they have the public sector is usually overcrowded, and sometimes you don't get the care that you need in the time that you need it. But on the other hand, it's free and way more people are covered. So that's something that you can look at, evaluate, and say, oh, is this something that we want to bring over to the United States? Is this something that we should be working on policy-wise? How do policymakers in Costa Rica, for example, how do they look at healthcare where in the United States, and how do they evaluate it to their system? But its influence on how we should do health is, like I just said, we really should be looking to other countries to examine what we can do better, see the policies that they've put in place, what they're making happen, what their policymakers look at to evaluate their system. And then this way we can look at our system. It's all comparing and contrasting, and that's how we end up with a better healthcare system. And so also with a global perspective, you get to see the cultural diversity that's present, and so you can help different groups of people better knowing what they're used to. So for example, some cultures don't think it's appropriate for a male practitioner to do a physical exam on a woman. And so knowing that beforehand, before you're in that situation, would be really helpful for you as a physician, as a practitioner. And so recognizing the cultural differences in healthcare is also a good reason to at least examine other cultures and have a global perspective on healthcare. The most impactful experiences for me were definitely the kids in the daycare. I know I haven't talked about that a lot yet, but I have a lot of pictures and videos at the end that I'm going to show, because that was by far what made this experience worthwhile, was hanging out with these kids every day and being able to organize activities for them. So I had them in the afternoon, and so we would plan different outdoor activities because they were inside during the mornings, and so during the afternoons we wanted to get them outside, get them playing. So we played jump rope, we would play pato pato ganzo, which is just duck duck goose. We would play soccer, casita, a bunch of different games to keep the kids entertained, kind of burn off their energy before they went home to their parents. But we would also help them brush their teeth, show them how to brush their teeth, how to wash their hands, good hygiene techniques. We would give them snacks. We would tell them which foods are kind of healthier, which aren't, what they should be eating a lot of fruits and vegetables. But the kids were only 2 to 5 years old, so you can only get so much across with that age group, especially with only the 2 weeks that we were there. So we did our best, but I loved it. I also traveled a lot while I was in Costa Rica. Me and my roommate with Marielos, we ended up renting a car and seeing a lot of cool places, and I have photos and stuff at the end that I will show to kind of see what that's all about. The most valuable take-home message for me was this quote that was actually in the Maximo Nivel office in Costa Rica, and it really struck me as soon as we got there, and it is, "The beauty of the world lies in the diversity of its people." So this really hit home for me when I was in Costa Rica, because we saw so many different people, completely unlike the people that we see in the United States. It was a completely different language. The way they lived, the food they ate was all different, and it was amazing. It wasn't bad. It was really cool to be able to experience a different culture and just live a different way for a little bit and try to take home some of the stuff that they practice and bring it into my own daily life. So, like I said, that was really cool. So some of the photos that I was mentioning earlier. So right here is one of the kids. A lot of them are Snapchat videos because those are the easiest to take. But this is Alana. I don't want to say I had a favorite, but Alana was my favorite. She was adorable. Every time I would come in, she would come and give me a big hug. This is Jaden. So during snack time, he would come and just hang out on my legs and just drink his juice, eat his food. Absolutely adorable. So yeah, they had their little uniforms if they were small enough. That was Hannah. She was pretending to be an airplane. Un avión. So again, with the Snapchat filters, we put un barba on Santi here, and he thought he would be able to lick the hair that's on his face, which obviously we know that it's just a filter. He can't do that. But really cool, really fun kids. I had a blast while I was there. Sorry, I have a lot of videos of these kids because they were just absolutely adorable. So you kind of get a scope of what the daycare looked like in this video. It was just a big cement playroom for the most part, and they would just play, and we would kind of come up with games for them. But most of the time, they knew what they wanted to do. But look at her little pigtails, so cute, and her little glasses. That was my roommate that I went with, Caden. Here he is. This is just my favorite video ever. I saved it till the end of these because Caden was hitting me, pretending to beat me up. But Alana liked me way better than she liked Caden. So I said, "Help me, Alana, help me." And look at how mad she gets. She gets, and she stops him. She makes sure I'm safe, which I was. Excuse me. But then traveling. So we rented a car. Here, let me move my head. We rented a car, and we went. So here's San Jose, right here. We went to the Manuel Antonio National Park. We only had one weekend, so what we did is we rented a car in San Jose, drove all the way down here to Manuel Antonio one Friday night. Saturday morning, we went to the park. Saturday night, we drove up here, so we made the 5-hour drive to the Arenal volcano. And so that drive is 5 hours not because of these accidents, but because the roads, the infrastructure of Costa Rica isn't the best. There's a lot of traffic in the city in Costa Rica. Everywhere else are very hilly, mountainy, curved roads. So not the best. We had to rent an SUV just to drive because a lot of the roads are unpaved, and that has consequences for healthcare, for ambulances. How do people get the healthcare they need when they're so spatially divided from cities? So these were the kind of things you think about as you're making these kind of drives. So to kind of tie all of this back, excuse me. This is me at Manuel Antonio Park, bug on my head. A lot of cool pictures that I'll just slide through. Beautiful beaches in Manuel Antonio. Really cool video. Here's a sloth. If you've never seen a sloth in person, they actually move that slow. It's incredible. And the word for sloth in Spanish is perezoso, which is also the word for lazy. So that just kind of shows you what kind of animals they are. But super cool. Never saw a sloth before. Crocodiles. I'd never seen crocodiles before. I had a lot of fun visiting all these places. That was La Fortuna waterfall near Arenal Volcano. This is Arenal Volcano. So this is the lake, but this way, that way, is the actual volcano, but you can kind of see the clouds. They actually covered the peak of the volcano that day, so we weren't able to see it. But there's the lake right next to the volcano, so I thought that picture would do just as good. Here's a big tree. I was wearing a poncho because it was raining. Rained a lot while we were there. It was winter time. But that was my experience in Costa Rica. I had a great time learning about their healthcare system, learning a little bit about their culture, their language, and super grateful for the experience that I had. Super grateful for the people that I was put with Marielos and the daycare center. So, thanks. Hope you enjoyed it.